Hello, I'm Andrew Shore from Patient Power for Banner MD Anderson Cancer Center. Women wonder, of course, about mammography. How often should they have it? How reliable is it? When should they perhaps have something they may have heard about, a breast MRI? And is there anything new that's come along to make things better so they can be more confident in the health of their breasts, or should cancer be detected, that it's detected accurately? Well, there is a new development. We're going to hear about that, and also certainly more about the guidelines and where breast MRI fits in. To help us understand this is a breast radiologist, a subspecialist in that area of radiology, and that's Dr. Vilert Loving from the Banner MD Anderson Cancer Center. Dr. Loving, thank you for being with us.
Of course.
Dr. Loving, so is there something now that is more useful than mammography that we've had for many years?
Yes, with mammography, there's been kind of a stepwise advance in terms of our technology. The widespread use of mammography started back in the 80s, and since then it's slowly progressed with better imaging. Now we use what's called digital mammography to improve imaging in the majority of women. But recently there's been another jump in technology, and that's with something called tomosynthesis. You may hear it also called 3D mammography. But it's been a significant advance in terms of our breast imaging because it helps to improve our cancer detection.
So for you as a radiologist, does 3D tomosynthesis give you a more complete view of the breast?
Yeah, so an easy way to think of it is a traditional mammogram, a 2D mammogram, is basically taking a picture of the breast. And so it's like when you have a camera and you're taking a picture of something, it prints out a photo, which is a two-dimensional photo, but there's no depth to it. There's no third dimension. And with tomosynthesis, we're adding that third dimension. And how that works is instead of taking a normal two-dimensional picture, the tomosynthesis machine is actually moving kind of like an arc over the breast, and as it's moving over that arc, it's taking multiple additional pictures. And so with those additional pictures, it's giving us more information about the breast. One analogy that I use for patients when I try to describe tomosynthesis and explain how it works is to imagine if you're standing in the middle of a forest. At the edge of the forest of trees, there's a person waving at you. If you had a camera in your hand, you're taking a picture of that person, you get a two-dimensional picture. So sometimes you can see the person easily, sometimes that person is obscured by trees and you can't see them at all. Sometimes you may see an arm sticking out waving at you, but oftentimes you may or may not get a good picture of that person just with that single photo. And that's the analogy to traditional mammograms, which just takes a traditional two-dimensional picture. And with tomosynthesis, the difference being when you're going back to that tree analogy, it's as if you're moving, taking a picture from one angle, moving to a different spot, taking another picture, moving to a third spot, taking another picture. And when you compile the data from all those pictures together, you get a better view. You get to see around the trees, you get a better view of that person that's standing there. And so that's the same idea with tomosynthesis. We're taking these multiple views and we're looking around the breast tissue and looking through it or around it on the edges to see the potential for breast cancer behind things.
So does that give you more confidence that you're getting a clear picture?
Yeah, so it definitely improves what we're looking at, and we consider it to be a tool on top of traditional mammography that just helps us to be much more confident and much more sure of what we're looking at to look for abnormalities that could be hiding in the breast.
Is this something you're now using routinely at Banner MD Anderson Cancer Center?
We are. When women come in for their yearly screening mammograms every year, we do perform tomosynthesis on all of those patients. So it's very helpful, and we do offer it to everyone that comes in. So
women have heard about breast MRI, some have had it. Where does breast MRI fit in?
It's a good question. So MRI, it's a lot of publicity, and people may have heard about it. And the tests or the studies have shown is that MRI is actually superior to mammography in determining or in detecting breast cancer, so we can find it much more easily. But the disadvantage that comes with that is that with that sensitivity in finding breast cancer, we're also finding a lot more benign or non-cancerous things in the breast. And with the MRI pictures alone, sometimes we may not be able to tell easily, at least, if something is cancerous or if something is non-cancerous. And what that leads us to in some people is with biopsies. And so a lot of people are going through with biopsies that are potentially unnecessary because we're biopsying things that turn out to be non-cancerous. So for that reason, we don't recommend it routinely for all people. We only recommend it for people that are considered to be at higher risk compared to the average population. And the reason being is because people that are at higher risk, it's justifiable potentially to go through with more biopsies because of their increased chance of having breast cancer compared to the average population.
So if a woman has a family history, maybe with a mom or her sister with breast cancer, where does breast MRI fit in? Is she considered high risk?
Yes, definitely. So we encourage all women that have either a question or they know that higher risk to discuss that with their primary care physicians. And there's a number of factors that contribute to a woman's risk of breast cancer. The common ones being family history, such as someone with their mother or sister that had breast cancer, particularly at an early age, or in some people they have genetic conditions that they know of that predispose into developing breast cancer. And people like that, it's important to talk to your doctor and discuss your risk factor and determine if MRI plays a role in your screening routine for breast cancer.
So it sounds like you're now at the point with imaging techniques that you have a good chance of spotting the breast cancer early, where it can either be cured or the effects can be limited.
Yes, so there's, in the breast imaging world, there's been a lot of research to improve our technology, tomosynthesis and MRI being two examples of those. And we're constantly researching and developing new techniques. And the goal ultimately is to look at the breast and to be able to distinguish what's normal and what's abnormal, and of the things that are abnormal, to be able to find them earlier and smaller at an earlier stage. We found that the earlier you find breast cancer, the better the chances of ultimately getting a cure.
So I know there have been federal panels that have made some recommendations. There's been some controversy. What do you recommend as far as breast cancer screening guidelines?
So at Banner MD Anderson Cancer Center, we are in agreement with the American Cancer Society in that we recommend annual screening mammography, so once a year, starting at age 40 and on from that point. And we found that screening schedule is optimal for minimizing breast cancer mortality. In other words, finding breast cancer at its earlier stage and improving chances for a cure. Dr.
Vilert Loving, breast radiologist at Banner MD Anderson Cancer Center, thank you for explaining this for us and our viewers.
You're welcome. Thank you.
I'm Andrew Shore from Patient Power. Remember, knowledge can be the best medicine of all.